How is maternal mortality ratio, MMR, calculated? Imagine a world where every pregnancy is safe and every mother's life is protected. To understand how close we are to that goal, experts use a special number called the maternal mortality ratio. This number helps us see how many women die during pregnancy or shortly after giving birth. It's a vital part of understanding population health and how different age groups are affected over time. So, how do they figure out this number? Well, the maternal mortality ratio is calculated by taking the total number of maternal deaths in a specific period, usually 1 year, and dividing it by the total number of live births during that same time. Then, they multiply that result by 100,000. This gives us the number of maternal deaths per 100,000 live births. For example, if there are 50 maternal deaths in a year and 2 million live births, the calculation would be 50 divided by 2 million, then multiplied by 100,000. The result shows the risk level for women giving birth in that population. Getting accurate data is key. Maternal deaths are identified through death certificates, medical records, or interviews called verbal autopsies. These sources help ensure the numbers are correct. The denominator, the live births, comes from birth records. In the United States, vital statistics systems gather this data, but sometimes reporting can be incomplete or misclassified. To fix this, statisticians use models and adjustments to improve accuracy. Understanding the MMR also involves looking at other related indicators. The maternal mortality rate measures how many women die from maternal causes per 100,000 women of reproductive age, usually between 15 and 49 years old. This helps us see the overall risk for women in that age group. Sometimes, health officials look at the proportion of maternal deaths among all women's deaths or estimate the lifetime risk of maternal death, which predicts the chance a woman has of dying from pregnancy during her reproductive years. Because collecting perfect data is tough, experts use methods like reproductive age mortality studies. These involve identifying all deaths among women of reproductive age and investigating the causes to confirm if they are related to pregnancy. In the United States, the data from vital statistics is combined with investigations and statistical models to produce official estimates of the maternal mortality ratio. These numbers help track trends over time and reveal disparities among different groups, guiding efforts to improve maternal health. In the end, the maternal mortality ratio is a clear, standardized way to measure how safe pregnancy is in a population. It reflects not just medical care, but also social factors that influence women's health during pregnancy and childbirth. By understanding how it's calculated, we can better appreciate the importance of ongoing efforts to reduce maternal deaths and keep mothers safe everywhere.